Hey guys, this is Dr. Jim Anderson, and I'm here to talk to you about your restless legs, and I'm really excited to present this because it's going to give you even more hope that there's a chance, there's a great possibility that there's hope for you to actually reverse your restless legs once and for all. So like many of you, you might be watching me late at night, maybe it's 3 or 4 o'clock in the morning, everybody else out in the house is sleeping, but you're up. Unfortunately, people don't understand. They don't get how severe this can be. It's truly a problem that I have a passion to help people with because you're suffering through the night while the rest of us are sleeping. And I totally have heard so many of your stories. And I'm glad to say that we've been able to help a lot of you get back your life and get your nights back so you can sleep through the night. So if you're new to listening to me on YouTube, understand that what I do is surgically reverse restless legs. There's some non-surgical options, but what we're known for here is our ability to open up nerve tunnels that have become tight, much like carpal tunnel surgery in the wrist. We're able to do that usually on 2 or 3 nerve tunnels in the lower leg, and within oftentimes 2 or 3 days, patients are 90% improved. Big change, very rapid, happens for many of these people. So what we're here to talk to you about is the fact that you don't need to necessarily be on these medications, the ropinirole, the Maripex, the Neurontin, the gabapentin, and maybe even some narcotics. I think that's a situation that a lot of you, that's all you're hearing. You're hearing about the drug, about Big Pharma. You're being marketed to very heavily, and I think there's a place for that, don't get me wrong, but I want to give you a way out, a way to maybe avoid going on those medications, or if you're on those medications, maybe get off the medications, because many of our patients are able to get off the medications that they're currently taking. So what's all this behind me? Let me kind of do a little intro into this data, and then we'll dive into it here in just a minute. First of all, understand that I do surgery with intraoperative nerve monitoring. I did this a lot in years ago, particularly in neuropathy patients, and now more with restless legs patients. In fact, one of the more prominent studies that I did was a study on diabetic neuropathy, and we did intraoperative monitoring of the nerves so we can compare before and after what happens when tunnels are opened, that nerves are functioning better afterwards than they were before surgery. It's objective information that's been published with 2 other papers that I've done on diabetic neuropathy. We're finding the same principle applies with restless legs. Compression can be the problem. And I would like to use a new term for restless legs. I like to call it restless legs compression syndrome, because for I think the majority of you that this is an issue. You really may have tight nerve tunnels in the lower extremity, and this proves it. This is evidence to back up what I'm trying to explain to you right now. So as I go through this, understand what we do is we stimulate a nerve in the operating room. We get into the surgical arena, we open the area up, and right before we open up the nerve tunnel that is tight, we stimulate that nerve. Then that nerve is sending a message down to the muscle that it services, where it goes and it contracts that muscle. So the muscle will contract, okay? And for a lot of you, maybe you've heard of intraoperative, or you've heard of EMG. That's really what this is. It's intraoperative EMG testing. And so what we're doing is stimulating the nerve before, then we record the amount of amplitude or the amount of contraction that's taking place in that muscle, and we have a certain power setting. We stimulate it, we do our surgery, get rid of all the pressure on the nerve, we do it again, same amount of energy or power, and then we see if the amplitude has improved. Is there a stronger contraction? Is there a higher wavelength? And that's what this is all about. It's all about the amplitude. So objectively, that's telling us, you know what, that nerve is functioning better now within minutes after surgery, which backs up what we find patients saying, because many patients within 2 or 3 days after surgery are saying that they're 90% improved. Rapid subjective improvement from the patients reporting back to us, but also this is showing us objectively with nerve testing that this is actually taking place.
So it may be kind of hard for you to see this because the printing is sort of small. Excuse me for that, but I'm going to read these off to you. So at the top of this scale is the number 10,000, and down here at the bottom is 5,000. And this stands for millivolts. And what these bars represent are the before numbers, which are the blue bars, and then the after numbers, which are the orange bars. So in the case of this muscle, the PL stands for peroneus longus. What happened was, for the patients that were tested, the average number before was around 5,700. This is before the nerve tunnel has been opened, and then afterwards it went all the way up to over 8,000. So with my rough math, that's what, maybe around a 70% improvement after surgery. That same nerve that we stimulated, it's called the common peroneal nerve, it also services and sends messages, electronic, sends a current down to the tibialis anterior muscle. So TA stands for tibialis anterior. The blue bar is the before, and again, the orange bar is the after measurement. And before was around 6,400, and then after was about 8,000, close to 8,000. So again, huge improvement with that other muscle group. So let's go over here for a second. This is my artwork, my rendering of what we see in the operating room and what we see on the monitor as we're doing the test. So first off, this is my rendition of a nerve under pressure. When we are in there, we use magnification loops, and it's very easy to see when things are magnified that there's compression on the nerve. The nerve actually has an indentation in it oftentimes. So this would be, those little arrows indicate there's pressure on the nerve. And in fact, before you have surgery with us, we oftentimes do ultrasound measurements of these nerves. So we're looking at the nerves, and we can actually measure how the diameter changes at the compression site. The nerve is smaller, and then on either side of the compression site, it's larger. So that's what we see in the operating room, that's what we see with ultrasound. So this would be an example of what you see on the monitor before the nerve tunnel has been opened. Very small waveforms, and I kind of scratched in here the beginning waveforms here for the peroneus longus and tibialis anterior of about 57 to 6,400, okay? So tunnel's been open, more current can flow, more flow of electrical current, more health to that nerve. Nerves don't like compression. There's about 10 different things that happen when nerves are under a lot of compression. But just understand you have a better functioning nerve after the compression's been released. And then this just is showing you on the monitor how we see a bigger amplitude. So that's basically the principle of what this is. Very significant finding, very objective finding, because so many of you are taking medications, there's side effects, and you don't even know exactly what they do. There's theories about what they do, there's concepts about what they do. In fact, one of the medications that you take when they're looking at dopamine levels in the brain, they do imaging, and there's really not a lot of strong, consistent evidence of what's different with your brain in a patient suffering from restless legs versus those that aren't. So this is very more compelling, I would argue. It's much more objective evidence of what we're doing is having a positive effect. And as I always tell patients, you know what? The symptoms are in your leg, and guess what? The cause is in your legs in many cases. We're putting out the fire where the fire is burning, and that's in your legs. So exciting news. Hopefully you think this is interesting. If you want to find out a little bit more about myself, I wrote a book called A Perfect Night's Sleep. It explains a little bit about how in the world a podiatrist got into this thing called Restless Legs Syndrome. It makes sense if you read the book. And oftentimes it's somebody from the outside looking in that can change things. There's a whole chapter in the book about that, because I find it interesting in all different walks of life, how it's not always somebody on the inside that figures things out. You have to be looking from the outside in, and it gives you a whole other perspective on things. Again, very excited about this. Hope this was informative. I ask that you subscribe to our channel. Please share this with other people you know that might be suffering from restless legs. I realize, hey, this isn't for everybody. Maybe you're not
that inclined yet, you're not suffering that much yet, but I want you to park this away in your mind that there is hope for those that are suffering, especially if you have very serious restless legs. So please consider this, and please consider subscribing to our YouTube channel. I welcome any kind of comments. I'll keep on teaching you, and I hope you keep on listening to me and learning more and more about nerve conditions that you might be suffering with. So thank you for watching.